Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: blood poisoning. Blood poisoning, sepsis, has nothing to do with poison. Instead, its primary cause is the presence of germs, which enter your bloodstream from an infection elsewhere in your body. This can happen through wounds, burns, cuts, and scrapes. Bacteria can come from something as simple as a sinus infection. Although blood poisoning is often a result of a bacterial infection, even a COVID-19 viral infection can lead to sepsis as well as influenza and fungal infections. Any of these situations can lead to blood poisoning. There are two ways in which a poison can attack our bodies. It may be taken in through the mouth and enter the body by way of the digestive organs, or it may enter directly into the bloodstream through an abrasion or cut in the skin. In any event, every poison eventually works through the blood, and the poison of infections works into the bloodstream directly. The smallest cut, abrasion or scratch is large enough for germs to enter. If they are not washed off, they will cause an infection which could lead to blood poisoning. If left untreated, a hand or arm could become so infected that it might possibly have to be amputated. Should you find yourself with a small scratch or cut, be sure to get it washed out and properly covered with a clean bandage. An ounce of prevention is worth a pound of cure. Serious cuts and lacerations need to be treated by professional medical personnel. Most often you'll run up against smaller injuries, burns, nicks, scratches, and cuts. The danger here is that most workers don't bother to get first aid for these minor injuries. The bottom line is, don't neglect cuts and abrasions. Do your part by trying to prevent them from happening in the first place, but when any injury occurs, serious or minor, be sure that it receives the right kind of treatment, as quickly as possible. First aid kits must be checked frequently to be sure they are clean and fully stocked. This applies to your home and car or boat as well as on the job. Untreated infection in the bloodstream can trigger sepsis. Sepsis is the body's life-threatening response to a bacterial infection and is often a medical emergency. Sepsis happens when a condition you already have triggers a chain reaction throughout your body. Bacterial infections that lead to sepsis most often start in the lungs, urinary tract, skin, or gastrointestinal tract. Without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death. Blood poisoning requires immediate treatment. This is to prevent sepsis from infecting major organs, like the lungs, kidneys, and heart. Sepsis is unpredictable, aggressive, and progresses rapidly. Keep minor injuries minor. First aid treatment is important to prevent infection.